This year, for the first time, the CDC's been tracking the influenza virus, and it's been found to be prevalent in all 50 states. The most prevalent strain right now is the H3N2, which tends to be a more aggressive strain than most. It results in more hospitalizations, complications, and children under 5 are especially more likely to develop those complications, especially babies under the age of 2. The flu shot is still the best way to prevent the influenza virus. It can be given as early as 6 months old. The CDC states that it's 33% effective against the flu. Even if you do catch the influenza virus, it can help reduce your symptoms and make the duration of symptoms shorter. It can also prevent you from getting other strains of influenza that were in the vaccine. It can circulate into May, and we do recommend you getting the vaccine as soon as possible. So the common cold typically has a more gradual onset of runny nose, congestion, cough, sore throat, whereas the influenza virus is a more sudden onset of more severe symptoms. So the flu has typically a high fever, runny nose, cough, congestion, sore throat. In addition to body aches, headaches, muscle aches, it also can be associated with vomiting and diarrhea. Well, if you're ever unsure, you should call your doctor's office and ask. If it's after hours, you can contact Beaver's Nurse Advice Helpline. I would definitely call 911 if there's any bluish discoloration to the skin, any difficulty breathing, if a child is difficult to arouse or wake up, if they're very disoriented. Otherwise, medical symptoms that would necessitate being seen by a doctor include high fevers over 102 that don't respond to medications or cooling measures. They're confused, if there's any concern for dehydration, such as a drop in urination or decrease in wet diapers for babies, if a patient is unable to drink fluids or if a baby's unable to feed, they're dizzy, it doesn't have any tears when they cry, those can also be signs of dehydration. If there's a fever with a rash, severe persistent vomiting or diarrhea, severe abdominal pain, muscle aches, headaches, persistent sore throat, congestion, runny nose that aren't going away, if there's any earaches, hoarseness, wheezing, difficulty breathing, or if you had influenza-like symptoms that improved and then proceeded to get worse. There are some things you can do at home to help your child with influenza. Resting and staying at home when they're ill is important. You want to stay home for at least 24 hours after the fevers are gone. Also, you want to encourage plenty of fluid intake, keep them hydrated. For any fevers, body aches, headaches, you can give Tylenol or acetaminophen starting at the age of 3 months, or ibuprofen starting at the age of 6 months, and cooling measures like a cool washcloth to the head. You also want to avoid giving any aspirin to children and any over-the-counter cough or cold medicines to children under the age of 4. For nasal congestion, blow your nose frequently, or for infants you can use a bulb suction. Nasal saline spray can be very helpful to help break up the congestion and rinse out any virus or bacteria particles in the nose. Using a steamy shower or humidifier, and also elevating the head of your bed while you're sleeping by using an extra pillow under your head, or for infants, propping the mattress. For raw red noses, you can apply Vaseline or lanolin. Sore throats, you can gargle with warm salt water, drink warm fluids, and for children over the age of 10, you can give throat lozenges. Younger than 10, we'd avoid them because of a choking hazard. Tamiflu is an antiviral medication that can be used to treat influenza, especially to those patients at higher risk, such as those with any chronic illnesses. It ideally should be started within 2 days of symptoms starting, and it is continued for a 5-day course. It can help make your symptoms less severe and help shorten the duration of your illness. You should talk with your child's pediatrician to see if this is a medication that should be prescribed to your child. Antibiotics would only be helpful if your child also has a bacterial infection, such as an ear infection or a sinus infection. Women with influenza should continue to breastfeed their babies. The breast milk can help pass antibodies to the baby that can help them fight off infection. If there's a healthy adult in the house that can help care for the baby, then that would be ideal, and the mom can pump to help provide the breast milk. Use precautions such as a mask to help prevent yourself from sneezing or coughing on the baby, and make sure you wash your hands often.
Dr. Barr currently works at our Colton office, but will be transferring to our Redlands Oasis Pediatrics office on March 1st.